Hello beautiful people in YouTube and welcome to this video, a very requested video. I'm very excited to do it. We're gonna talk about how to prepare for your hip surgery. I understand that once you get diagnosed with something and the surgery is scheduled, there are a lot of things that you have to take care of and it can be very overwhelming. So I prepared this video based on my experience to give you another testimonial of what you might need during your surgery so you can get ready and you can just ease into that recovery. We're gonna have two parts. This video is part one, which is the practicalities of getting ready for your surgery. And part two will be the mental aspect of getting ready for your surgery. Without any delay, let's get started. Okay, so you've been diagnosed with a hip impingement or a labrum tear or both things, and now you have to get surgery. So the first thing that I did and that I have heard that people have done is get into PT pre-op. Build as much strength as you can in your hips and your legs because that is gonna help you a lot during recovery. I have heard from other people that have gone through this, and with my own experience, I can say that having gone to physical therapy before and building that strength is giving me a smoother time during the recovery. Going to physical therapy before your surgery is also a good time to test the different professionals that you could work with. Typically, the clinic will assign you a physical therapist unless you already have a name in your head. And I believe that this moment is really crucial for you to talk to that person, explore their style, and align your goals and see if that is actually a match. Because if it's not, you can still find someone else that can work with you. I believe that it's crucial that your physical therapist is aligned with your goals, especially if you're an athlete. Find someone that you trust and that you feel comfortable with, because this person is the one that at the end is gonna help you go through the recovery phase. The surgeon plays a very key role during the surgery and your post-op with the checkups, that there is going to be a point in which the surgeon is gonna hand over your recovery to the physical therapist. So you really need to have someone that you are happy with. And during the recovery, there are so many ups and downs that I have ended up crying countless times in that physical therapy clinic. And my PT has had to live it with me. And thank you so much for that, for my PT. And I feel like the only way that I could feel comfortable expressing all my frustrations is if I had someone that I trust. And I do. So very important, get a good PT, get in PT before the surgery and get as much strength as possible. Another thing that is good to have before the surgery is just do as many activities as you want. Like everything that you like, do it. Like get tired. Tire yourself, like be like, I don't want to know about going out ever again. And that is the perfect moment to go into surgery because you won't go out for a long time. I think it's really good to just overload yourself with activities that you like to do, and that way, as you kind of like purge out a little bit of that desire, so you be a little bit more patient probably while you're recovering. Make sure that you are very clear on the steps before the surgery, the pre-op appointments or exams, registering with the hospital, and any other thing that you need to get done. Make sure that your surgeon or their team is very clear with that so you don't miss a step. Sometimes it's good to have someone else going through the steps with you, because a second pair of eyes, especially in a moment where you're so overwhelmed with information, is good so you don't forget anything. Pick up your medicine before the surgery. There are some pharmacies that would give you the service of bringing the medicine to your bed, but if not, make sure to pick it up before the surgery. You don't want to be waiting. I picked it up before, okay, but they didn't have two things, so we had to go to the pharmacy on the way back from the hospital, had to wait in the drive-thru, and it's not fun. So try to pick up your medicine before the surgery. And when you get your medicine, ask your doctor if it's necessary to have a stool softener, because anesthesia and the painkillers would cause some constipation, so you might want to have some stool softener with you as well. And make arrangements. If you take care of someone, make arrangements so you know that that someone is going to be taken care of. Kids, pets, loved ones. Make sure that everything is taken care of, and that way you don't have to stress about it. And also, depending on your living situation and how much help you're going to have, it's also good for you to meal prep probably dedicate a day making a lot of food, put it in the freezer, and then when you don't feel like you want to cook or you cannot cook, you're gonna have food ready for you. Put everything you think you're gonna use after the surgery at reach, like move everything higher so it's easier for you to get that object. If you're driving or if you have a car, another important thing that I think it's a very good perk is to pick up a handicapped sticker. It depends on wherever you live. Talk to your doctor. They might have the information, or just Google in the local motor vehicle office that can give you an idea of what you would need for this temporary parking permit, because believe it or not, it's super useful. I did not do it and I regret it, because even after you are done with the crutches, because during the time of the crutches you're really not gonna leave, so it's not that much of a big deal, but when you drop the crutches you're still gonna want to park closer to the door of your destination. For the first months it's not fun to walk for long distances, so I very much highly recommend you getting that parking sticker. I think that's it in terms of like the pre-op. And then let's talk about the items that you might need. Your surgeon will give you a specific list of items that you will need during your recovery. The protocols are different. Some surgeons use some items, some others don't. So don't freak out if you don't get the same items that I did. But I'm gonna give you a list of things that I used during my recovery. First and foremost, the crutches. You will need crutches to move around, so don't forget them, please. Some people prefer walkers, so that's a thing that you're going to want to discuss with your surgeon and see what the best option for you would be. The second thing that I got is this hip brace. So this thing goes around your hip and it gets attached to your leg, and it's supposed to hold your hip while walking. I woke up wearing this thing after surgery, and just having it around my waist gives me a little bit of PTSD, so excuse me. Then I also got these boots. I know they don't look like boots, but your feet go in here, and that's how you sleep. The first weeks, your hip is supposed to stay stable, and your feet are supposed to sleep like this. So that's what this device would do, keep you upright. And this comes with this thing as well that goes here to keep it, I guess, more secured. I wore this until probably week 10 just for psychological purposes, because I was still very paranoid of sleeping like a dead spider, so wanted to make sure that everything was in place, and I kept using this for a long time. And then the last thing that was mandatory was this device that goes around your cuffs and pumps air in it, so it helps your blood to circulate. The risk of blood clots is really low in this surgery, but I still want you wearing this for 6 weeks at least. The other thing that was mandatory for me was waterproof band-aids, because they didn't want anything to get near the incisions. So I was allowed to shower 3 days post-op, and the recommendation was to put waterproof band-aids on it so the incisions stay dry and clean. Okay, now let's talk about things that would be nice to have. Some of them I had, others I didn't, but I figured it was interesting so you can make a decision on what you think it would be useful for you. First and foremost, ice machine. That thing is a game changer. I am not kidding. Like, I really did not believe it when people said that that was the most important thing after all the other mandatory devices. In my case, it was every hour of the day while I was awake, at least. People go to bed with it as well. I didn't do that, but yes, you are supposed to ice your hip as much as possible. And having ice packs can be a little bit inconvenient if you need ice so often. So an ice machine is really a game changer, and a recommendation that I have for the ice machine is to fill up water bottles and freeze them like that, because you're gonna need so much ice that the water bottles, you can put like 2 water bottles on the side and then fill up the rest with ice, and that's gonna save you a lot of ice. So you can have probably like 4 water bottles and like just go through them. That's gonna save your life, because by experience I can tell you that the fridge doesn't restock as often as the amount of ice that you're gonna need. Something that I debated a lot was whether I wanted to get slip-on shoes or not, because you won't be able to touch your toes. You won't be able to put socks on and your shoes, forget about it. So a lot of people have chosen to get some slip-on shoes. I didn't find the design that I liked, and they can be pretty expensive. So I thought to myself, if I'm gonna buy something that expensive, should be at least something that I like. And I didn't find anything, so I figured that I was just gonna wing it and go for the best. So I didn't use them, but I did have help for the first 6 weeks, so they would help me put on my shoes and my socks. How do you go to the bathroom? That's a great question that I have received lately. If your toilet seat is the same height of a chair, then it's not really recommended to get a toilet seat. I guess the caveat here would be, do you have something to hold on to? The bathtub or the furniture of the sink, or something that would allow you to hold on to sit and to stand up? If you do, I personally don't consider that you need a toilet seat. If you don't have anything to hold on to, or if your toilet seat is lower, then you might want to consider getting one of those things. And along the same lines in the bathroom, the other thing that people debate a lot about is the shower chair. I asked my surgeon, my PT, and they said that I didn't need it. And I don't think I would have needed it, or I don't even think I would have used it. Because at the beginning of your recovery, you're not even allowed to sit. You know, like, you're not really sitting. It really hurts. You're not supposed to be sitting, or at least that was a protocol for me. I was supposed to be standing 70% of my time. So I don't think I would have showered sitting. That doesn't sound comfortable or pain-free. So the way that I did it is I went in the shower with help. I had one crutch in the shower. You can check my video of the first weeks where I explain exactly how I did this. If you just right now, while you're watching the video, stand on your feet, and you're gonna see that you can really stand just on one foot, not putting any weight on the other one and having the other one just like hanging there. So that's basically how you shower. You put all your weight on the non-surgical leg and then probably find a wall or something to hold on to, and then you can shower. So I don't believe you need to buy that. But again, personal preference. If you believe that that's important for you, then go for it. I highly recommend loose clothes, because you will have a gas here at the beginning, and then when you take that off, you're going to have your incisions there. So having something too tight is not gonna feel comfortable. And also having fabrics that are too rough on the skin is not gonna feel good. Loose clothing, something that you can feel comfortable in. And it would be good if you can have some pockets, either, well, not really in your pants, because if you have to wear the hip brace, these pockets are not in reach. It's good depending on the season where you get your surgery. A hoodie can be a good idea, a fanny pack, backpack. I did see there was someone that said that they had found this crutch bag. So it's kind of like a bag that you attach to one of your crutches, and you can put all your stuff there, including your water bottle. What I ended up doing actually was that I would put my cell phone here, because like the brace was here and it was so tight that I could put my cell phone and I don't know, something else here, and just like keep going. So that was also a very easy way to transport at least my cell phone. Talking about the crutches, another thing that people do is they get padding for the crutches. I do have a disclaimer there. I did have the padding, but my physical therapist showed me how my wrists were not in the right place because of the padding. You know, like you have the padding that is usually going around the handle of the crutch, and also like in the armpit section. It goes around, it doesn't glue to the handle. So when you hold it, it's moving. So you hold it in one position and then your wrists can like go like this, or like it can get weird. He didn't recommend it. I kept the padding for the armpits, but I ditched the padding for the handles. Another accessory for the crutches I've read is a grabber. You know, like those things that you use to grab trash. People Velcro the grabber to the crutch, and that helps if you drop something. You don't need someone to come get it. You can just like grab it yourself with this tool. Another important thing to have is pillows to help you release the pressure when you're sleeping. If you have to sleep like I did on my back for a long time, that is gonna cause a lot of pain. So I had several pillows that were helping me ease the pain and how uncomfortable it was to sleep like that. Some people also have spoken about over bed tables. They say that they could work on the bed while they were recovering or eat on the bed. So probably an over bed table may be a good option for you, just something to think about. And the other thing that people have said is to organize the pills. However, it's better for you, and I do agree with that. I did organize my pills. I put stickers in each of them so I knew which one I had to take in which meal, because they are going to send you a bunch of pills at the beginning and it can be a little bit overwhelming. And then the last thing for this list of items is a stretching strap or a belt. Some people have said that they have used that to lift the surgical leg, because you won't be able to use the leg for anything, actually. So, for example, if you're getting on the bed, you'll have to help that leg get on the bed. My physical therapist showed me a very convenient way of doing it, which was to use the other leg to lift the leg. But some people use belts or stretching straps to do that as well. This is the end of the list of things that I have seen people use or get, or that I have gotten as well. And I hope that this can be of help for you. If you have gone through the surgery and you're watching this video out of curiosity, leave us a comment if I'm missing something. If there is something that you think it's game changer and I haven't mentioned it, or if you are backing up one of these things that I'm saying, leave it in the comments, because I think it's really important for people to have different testimonials. My case was one, your case is going to be different. So I would love to hear more about what people used for their recovery. Again, I hope this was somehow helpful. I'm sorry that you have to go through this, but think that this is gonna go great. The best way to face the recovery is being patient and positive thoughts. And it's gonna get hard at some point, but it's really important to keep your spirits as high as you can. Good luck with your surgery. I hope everything goes well, and thank you for watching this video. Bye.